Hi friends, I am Dr. T S Srinath Kumar, emergency physician heading the SPARSH group of hospitals. Today, we are going to see what if a patient suddenly falls unconscious. Whenever you see a patient is fallen suddenly unconscious, what you are going to do. Every step is important when you see somebody falling unconscious. First is scene safety, your safety, patient safety, and the environment safety. So before going near the patient, just look around the patient for 10 seconds, see that there is no any electric wire or any snake bite or toxic substances, and then shift him safely to the platform so that you are avoiding traffic jams or anything else. So once you shift the patient to a side, you can call for help and ask them to call for the nearest ambulance services. So that part is taken by the second person. Meantime, what you do is you catch hold of both the shoulders and say, "Are you okay?" So that if the patient is responding to you, that means that there is not much of an issue. If he is not responding and if he is not breathing, you also examine for the breathing within 10 seconds. Usually you will see at least 2 breaths. If he is not breathing, there is no response, then immediately you have to look for the pulse. Usually the pulse is not felt where it is to be felt in the forearm. Usually you feel for the pulse in the neck. You can feel your trachea, just go by the side. You will feel a groove, that is called as the carotid pulse. You feel it for 10 seconds. If the pulse is not there, then immediately you should start something called as cardiopulmonary resuscitation, CPR. So this is a case of sudden cardiac arrest. So whenever you see sudden cardiac arrest and there is no pulse, immediately you have to start compressions. How do you give compressions? You have to hold your hand straight. All the three, the shoulders, elbow and the wrist should be in straight line to the patient. You feel yourself, this is the sternum, this is the middle part. You should press only on the sternum at a rate of 100 to 120 per minute and a depth of 5 centimeters, because when you're compressing, you have to compress the heart and then you have to leave it. But at the same time, you should not leave the hand from the chest. You have to do it for 2 minutes. After 2 minutes, you can recheck for the pulse or look into the response. If there is no response, no pulse, then you can continue for CPR until the ambulance is coming to you or qualified help arrives to you. To know all these things, I would suggest you to call on us to get a free training on CPR, because our motto to save a life at that not golden hour, it is the platinum seconds, what we call. Every second you lose, you're going to lose your friend, relative or somebody. So this is an important message to the society, and we as emergency physician in SPARSH group of hospitals are intended to train each and every public in this particular CPR. Thank you. So if anything is there, you can visit us.